We'll make a start. Thank you, and thanks everybody for being here today. It is so exciting to be here face to face. It's been a long time since we actually looked at people and saw you for the real, rather than just your faces on a screen. So thank you very much for coming today. My name's Joy Humphreys. I'm the board chair. I've been in this role for 4 years, and I'd like to welcome you all to the AGM for Great Ocean Road Health for the period 22-23. I'd like to acknowledge country. To start our meeting, we, Great Ocean Road Health, acknowledge our offices are built on unceded lands of the Gadiwin'in people of the Maar Nation. We pay our respects to all First Nations peoples and will continue to strengthen the complex knowledge systems of health and healing that intertwine the landscape and communities we live and work in. Great Ocean Road Health is committed to improving health outcomes and pathways for First Nations people and ensuring a culturally safe environment. The board acknowledges that all formalities related to this AGM have been resolved outside the meeting. Previous minutes from Great Ocean Road Health AGM 2021-22 have been endorsed by the board. And one more formality, welcome to our dignitaries that are here today, and apologies from a range of partners, friends and colleagues are acknowledged. We have apologies from staff and we have apologies from board directors, the Honourable Rob Knowles, Dr Tiffany Symes, Fiona Williams and Associate Professor Kelly Nicola Richmond. To start with, I'd like to just talk to you about the highlights from a board perspective. On behalf of the board and my colleagues who are here today, and they're located up here in the front seats, I'm pleased to present to you the 2023 Annual Report for Great Ocean Road Health. This report highlights significant achievements and progress made by Great Ocean Road Health during July 2022 to June 2023. Today, my role is to host the meeting and provide you with some updates on what we've been doing over the last 12 months. I couldn't go any further without starting with you, Sandy. As our leader and CEO, we're very lucky to have Sandy as our CEO, so I want to acknowledge all the work that you do and personally just say thank you for a great working relationship. We've had a lot of fun over the last 4 years, and Sandy's a very strong leader, and I could see people smiling and nodding in the audience, so... I think it's Sandy's role modelling, but she leads a staff who are resilient and kind. And I hear lots of stories about ongoing good humour, even when you are faced with a COVID-19 pandemic and all the struggles that that brings. So thank you to the staff for your dedication and commitment. I think you are an amazing group of people. You are commendable. The board acknowledge and are constantly amazed about your resilience and how much you put in when it's so tough out there. I can see that you understand the importance of health and taking care of each other, and we know that that work that you do with each other helps the outcomes of the patients and the people and visitors that come into our service. So thank you for looking after each other. Whether it's about taking care of daily activities for residents or ensuring that everybody is managed safely, or you are taking care of each other when people are fatigued or on furlough, you make sure that we do all the things we need to do with safety, and that's why we have been successfully accredited again over the last 12 months. We recognise that your efforts are tireless and we appreciate that. Thank you. We have a governing board of 10 directors. Each has a diverse background, skills and experience, and our role is to be diligent in providing governance. We're responsible for ensuring that Great Ocean Road Health meets the requirements of the Department of Health through our statement of priorities. We make decisions based on that and in alignment with our strategic plan, which you will have seen, the Great Ocean Road Health Strategic Plan 2022-2025. The board meets monthly, and every second month we'll meet either at Lorne or at Apollo Bay or a hybrid meeting. When we're meeting on site, we're able to go in and meet with staff and residents and other visitors and have conversations which are important to us because we pick up information about culture and wellbeing and how people are experiencing our service. As part of our commitment to ensuring that we are providing good governance, We underwent an external review at the beginning of the year. There were some recommendations from that which we've implemented across the last 12 months. We have several committees, including the Safety and Clinical Governance Committee, which is chaired by Associate Professor Kelly Nicola Richmond. This Kelly, there she is there, she oversees the governance of the delivery of high quality and safe care. This year we made some changes to that committee, including the recruitment of 2 community members. These people provide us with their lived experience and offer different points of view. We altered the terms of reference, and now that committee has oversight not just of safety and clinical governance, but leadership. So leadership and how the staff are tracking is really important to us to hear about at the board. So now we have a Safety, Culture and Clinical Governance Committee, and we get reports to that committee from the staff's Quality, Risk and Safety Committee. We also hear about various things that contribute to the People Matters survey, and we hear things around the health checks that are done throughout the year. So we're keeping an eye on, if you like, what's happening with the staff. There's another staff committee which a board director goes to, Matt Dixon there attends the Internal Inclusive Practice Committee. This committee is about ensuring that we are creating conditions that are conducive to people with diverse backgrounds. Another committee we have is the Finance, Audit and Risk Committee. That was chaired by Paul Shannon until the end of June this year. Paul had been in the role for several years but has retired, and we now have Claire Power as the chair of our Finance, Audit, Risk Committee. This committee has the responsibility for ensuring that our finances are managed effectively. This is pretty challenging. We've got multiple funding streams because we come from a multi-purpose service and a small rural health service. We rely on some funding and grants and all sorts of ways that money comes in. And Claire will talk a little bit more about that when she presents the financial report. But all of these funding sources are there to provide aged care, community care, day services, residential care. There's a whole range of services we're able to do with these multiple sources of funding. I do want to call out our finance team because they've had a really hard job this year. So thank you to Joel and your team for all the work that you've done to keep us on track. We're very privileged to have another committee called the Community Advisory Committee, which gives us connection to the community. That was co-chaired by Tiffany and Fiona, and the group has got consistent community members who meet across the year to give us information about what is happening in the community. They also take information about the services that we're providing back out to the community. Bit of a call out, if anyone knows anyone that would like to join the Community Advisory Committee, please see me after the show. But thank you to all those people for their continuing to come, and that was really difficult because sometimes we had to meet online, and internet and access to those kind of services down here are sometimes a big struggle. This year, the Community Advisory Committee groups merged. We had one group in Lorne and one group in Apollo Bay. Now they have merged, and we have a new chair of that committee. In addition to these committee activities informing the board, we go, as I said, we talk to staff and residents when we're here on site. Not only do we talk and gather information and bring that back to the board, we're also able to bring that together in themes, if you like, which gives us data to help us in our decision making. We also report that back to our quality surveyors so that they can see that we are in touch with what we are doing in our decision making. It's one thing to make decisions, you've got to know what the results of your decisions are and whether or not you're making the right decisions. We're very lucky in our monthly board meetings to have access to staff and visitors and people who want to tell us their stories. So we've heard, for example, from Gerard Black this year. He came to one of our meetings and talked to us about the murals he'd painted. He's an Indigenous artist. If you've been to the emergency department at Lorne, you'll see his work. Extraordinary mural at the back there. We also heard another wonderful story about inclusion and acceptance from one of our partners, contractor, who identifies as LGBTQI+. he came to the board to tell us about his experience of being welcomed and accepted into our community of practice, into our staff group. That was a wonderful story. We heard from Terry Heng, Dr. Terence Heng at Apollo Bay, who talked to us about how the community had welcomed him into their community, and how that has helped him and his family feel like this is home for them, which of course strengthens our GP practice and the services that we're able to provide. Fortunately, we've been able to resume contact, and one of the delights that I had earlier this year was to be able to go to the Pieta pub and to see Dave Mullen and Jason and all that team down there in the bowels of the Surf Lifesaving Club providing care. It was fantastic. It's just, I can't tell you how proud I am when I go there and I see the staff doing such wonderful work for all those swimmers. They're mad, but anyway, that's exciting. Thanks also to the community team. We've done some wonderful things in community, growing services, particularly in our Better at Home program, and providing specialised training to staff, which enables care back home. So rather than a patient travelling, finding someone to deliver them, taking them to another service such as Colac or Barwon, we're able to provide that care here at home. We're really proud of our clinical teams. They were two shortlisted finalists in the Victorian Healthcare Awards this year. Each year, the board recognises the outstanding contributions of staff through the Meg and Jim Lawless Scholarship. We'll talk a little bit more about this later. Nick will present it for us later in the meeting. But this year, that was awarded to Jane Martman, who has undertaken advanced paediatric life support for children and babies. I do want to take the opportunity to express our deep gratitude for all the people who help us raise funds. We don't have a lot of money, so when there are fundraising efforts put in or bequests left to us, it helps us do that bit extra. Particularly to the Great Ocean Road Cycling Group, to the Second Sales Op Shop, to the Lawn Op Shop, and of course to Apollo Bay Health Foundation. We're also very grateful to anyone and everyone that has donated money to us or left bequests. And they do this because they are delighted and just want to find some way of expressing the gratitude they experience by the care that we provide. In the role of chair, one of my responsibilities is to participate in the Barwon Southwest Board Chairs Network. This forum is about creating better connections and collaborations and partnerships across the Southwest Barwon area. And I was fortunate this year to be part of the Victorian Healthcare Summit. It might not sound like very much, but it gives us an opportunity to influence decisions that are made about the state of health in Victoria. And I want to thank the department for their support throughout the year and all the things that we've been trying to do. In closing this part, I want to thank my fellow board members. We have Claire and Nick and Matt and Chris here today. You could stand up if you wanted to, but you don't have to. But particularly for your support for me in the role of chair. Nick is our deputy chair, and he's wonderful for me to give a phone call to and kind of test out some ideas. So thanks, Nick, for your great sounding board. To the committee chairs for all the work that they do, and for all their knowledge and the experience they bring to their roles. Again, I just acknowledge the Honourable Rob Knowles, who's away on sick leave at the moment, Dr Tiffany Sines, Fiona Williams, Matt Dixon, Kelly Nicola Richmond, Chris Price, Claire Power and Sean O'Reilly. On behalf of the board, thank you to all our staff. Thank you to our partners at Neighbouring Health Services for helping us do the work we do. Thank you particularly to all the volunteers, all the work you do around driving and gardening and listening and massaging hands and checking on people and helping, and your consistent kindness to our contractors, our consultants and our locum staff. Thank you for being there to help us continue to provide services. And to all our community members, thank you for your sustained efforts to support Great Ocean Road Health. I'd now like to pass over to our CEO, Sandy Chamberlain. Thanks, Sandy.
Thank you, Joy, and thanks for those kind words. It has been another year of challenges, opportunities and innovation at Great Ocean Road Health, with the trifecta of having limited finances or stretched finances, a fatigued workforce, some of whom are here today, who you might look around. Yeah, Jason's just yawning. Thank you. And communities which need our services more than ever. We've certainly noted in the past 12 months in particular a real increase of use of our services. Again, we rose to the challenge and got through the year more resilient and more positive about the year ahead. Now, I cannot not talk about COVID because, surprise, surprise, it's still around, when it has occupied so much of our time and resources in the past 3 years and last year, and remains third in the leading causes of death across Australia. This year we moved towards a COVID recovery or a COVID business as usual model by embedding the models of care that worked well and changing other ways of working. The use of virtual care, which used to be called telehealth, although not at the levels that they were in mid-COVID, still provide our clients with an opportunity to receive care without having to travel or present in person. Our increased infection control procedures and social distancing, yes, we still do that, have meant we've been able to limit the spread of other infectious diseases as well as COVID, which has been a bonus, and reduce both in our aged care residents and in our staffing groups. The ability for staff to work effectively from home has allowed our workforce to be more flexible and agile, and this was a theme that came through in this year's People Matters survey, how flexible our workforce is and how much they appreciate that flexibility. A continued focus on staff health and wellbeing has led to a positive culture being demonstrated every day and in our excellent People Matters survey results. These are our positives from our COVID experience. The negative impacts of COVID have been outbreaks in aged care. We've been fortunate enough to only have one outbreak at each site during the whole pandemic and another mixed respiratory outbreak at Apollo Bay. This is extraordinary in comparison with other facilities and a testament to the strong infection control guidelines in place. However, any outbreak in aged care leads to potentially very poor outcomes, and we were devastated to see our residents suffering in isolation. Emergency events, and that's something that happens a bit down the Great Ocean Road, I've found out, having been here 4 years, have included planned burns, threatened containment lines on St Patrick's Day, with both sites affected by road closures and some staff evacuated. Fortunately, due to a strong emergency response, there was no loss of property or lives. We've also had multiple weather events, including floods, and we had some flash flooding yesterday, and more recently an earthquake, just to add to our emergency response. As Joy said, there's been some amazing work completed in the quality and safety clinical space, and a shout out to Hilary. Can you wave, Hilary, who's our quality manager? And also Anna, who's joined the quality team in the community space. Amazing work done. I'm just going to tell you a little bit of a story about falls. So, falls in aged care have reduced this year by an incredible 20%. Clinical teams at both Apollo Bay and Lorne have maintained a high level of focus on falls prevention and management. Incident and audit working parties meet monthly at each site, bringing all clinical incidents to the meeting for discussion to share learnings. The degree of harm to consumers who fell also reduced an incredible 13%. A reduction in harm from falls is a sign that these strategies, such as bone density management, exercise programs, and skin care, are also providing effective care. At Great Ocean Road Health, residents are offered daily exercise classes, and GPs review medication for bone density on admission, 12 monthly, and after a fall has occurred. The recent dietetics menu review ensures that residents are not only being offered extremely tasty food, because I do sample it, especially on a Wednesday morning at Lorne, that is also meeting their nutritional requirements for calcium, protein, and other essential nutrients. Clinical staff are also including twice daily skin moisturising to improve skin integrity. So all these things have contributed to the 20% reduction, and they're evidence-based measures designed to support our residents to avoid harm from falls. So amazing. Thank you. We continue to have unexpected presentations to our urgent care, don't we, Carly? We expect the unexpected and train and train our teams post these events to ensure that everyone is prepared for everything. We've continued daily situational analysis response meetings to assist in managing all events, which has increased communication and confidence in the management of any issue. I've presented our emergency preparedness processes at Victoria-wide emergency management forums this year and have been asked many times for our documents in our meeting approach so people can replicate our approach. So kudos to the teams. Recruitment and retention have been the highest workforce priorities, especially at our Apollo Bay campus in the clinical team, as we've had to fill staffing gaps with an agency workforce. Joel's cringing as I say this because it does impact our financial result, which comes with increased costs and also local knowledge gaps. We've also trialled different ways of recruiting staff by utilising overseas recruitment for the first time, and excitingly we have Deepika on site today at our Apollo Bay campus who's come to us from India via Ireland, and we're delighted to have her family join us. Also asked for referrals from staff and people they knew, as well as the other traditional methods. We've also enhanced our accommodation offer and processes and have been able to provide a range of accommodation options to suit what we need to. Our Apollo Bay and Lorne medical practices continue to provide excellent services in the community and were both successfully accredited against national standards in 2022-23. We're delighted to continue our registrar training program at both sites with increased supervisors to assist Dr. Terence Heng and Dr. David Mullen. Dr. David Mullen and Joe York, who's one of our supervisors. We have been privileged to be able to offer great opportunities for our GP registrars and been able to continue to meet the requirements of RAC GP by giving our registrars experience at both sites, which has worked really well. We also changed our pathology provider this year and the way we provide pathology services to the community, which has led to increased satisfaction. Staff health and wellbeing continues to be a significant priority for me, both with a very active staff and health and wellbeing committee, and support and enthusiasm from the leadership team and the board. Thank you. Our program was a finalist in the Victorian Public Healthcare Awards in 2022 and has received, again, interest from other health services, and it's something I am very proud of. The People Matter survey results showed that these initiatives were working and that Gore senior leaders support stress, showing decreases in stress from previous surveys. Staff reporting high to severe stress actually decreased from 2020 to from 20% in 2020 to 17% in 2021 to only 14% in 2022. So obviously we're doing something right. Staff sick leave is also, which is an indicator to how you're going in health and wellbeing, has also been, despite COVID, consistently under 3%. So amazing. I think our staff are very resilient or very healthy. Workforce fatigue, Jason, you can yawn again, continues to impact our workforce, however, and we continue to try and be innovative in our approach to supporting staff. Our 2023 results are hot off the press, with the highlight for me being that 97% of our staff want to remain with our organisation. So well done. The Community Directorate has done some amazing things this year, and I'll highlight a couple of things, but ably led by Shelley, the home care packages continued to increase and we continue to provide better care to our community. Some of the highlights for me have been the Marrawarn Neighbourhood House at Apollo Bay has been reinvigorated with the appointment of a new coordinator, Carline Sass, who has initiated several new programs. There's the food bank here. The food pantry is a highlight for me and is an indication of the levels of food insecurity in our community. This initiative has been well supported by local businesses, special thanks to the Bendigo Bank and the Apollo Bay News Sheet, and local volunteers who stock food for those in need. Fresh food is donated on a daily basis and goes out and is taken by those who need it on a daily basis. It's an amazing initiative. A toy library and further groups for young families have also been provided. I'm very proud of what has been undertaken in this space this year. The Lorne Neighbourhood House and Occasional Care is back to being fully staffed for childcare services after a very challenging and turbulent 12 months with the recruitment of workforce, and I think you can probably all sympathise that childcare is a tricky space to recruit, like health and education. This is a challenging period for our service and the community, as well as other childcare services in Lorne are limited. And now to the op shops. Where would we be without the op shops? The second sales op shop in Apollo Bay has been able to extend hours and services for the first time post-COVID, donating an extraordinary amount of money to Great Ocean Road Health Apollo Bay campus. Expanded services this year include the highly successful pop-up shops in the aged care facility. And I can't stress enough the difference the pop-up shops make in the lives of the aged care residents. It's amazing. They talk about it for weeks before and weeks after. They absolutely love it. We also have one of our aged care residents working at the op shop, so thank you very much, Second Sales. Two other amazing initiatives. They've provided gift vouchers to our social workers to give to those in need of clothing and other household items. And there'll be a Second Sales Professional Development Staff Scholarship presented today, which is amazing. Thank you so much. The Lorne Op Shop, again, amazing support. They provide wonderful support for our aged care residents by providing care packages and equipment, totalling, again, an extraordinary amount of money. This support is very much appreciated by the residents, the families, the staff and the board, as Joy said. One of my highlights of Lorne is the sight of the Lorne aged care residents enjoying their glass of wine in happy hour at Lorne. It's amazing. They love it. And again, it contributes to them leading purposeful lives. So thank you very much to both op shops. Jason Vila, our acute nurse unit manager at Lorne, immortalised in our banner here, and in person down the back, continues to assist with the provision of extended practice nursing services overseas and has spent time assisting with a tuberculosis program in Papua New Guinea and in Vanuatu on board a health response and logistics support vessel operated by Respond Global, who offer health crisis management and operations solutions. We are delighted to support Jason, provide service to our Pacific neighbours, and Jason is also very happy to share his experiences with us, which adds significantly to our emergency response systems. Another thing I'm really proud of this year is we have continued to provide mental health first aid training to our staff and the community with excellent feedback from those participating. Great Ocean Road Health is officially recognised as a skilled workplace for delivering mental health first aid. Mental Health First Aid Workplace Recognition Programs celebrates organisations across Australia who invest in developing mental health first aid skills in their people and acknowledge their achievement and commitment to embedding training into their organisation's culture. I see this being used every day, and I've had evidence of this week, of when someone recognises someone who's not doing so well, they take action where they may not have done that before. I think that it's an amazing thing that we're doing for our staff and for the community. We've also expanded our reach by training our mental health first aid presenters in youth mental health first aid, which will be rolled out next year. And as I said, I'm extremely excited about the youth mental health first aid as well. We continue to actively listen to and respond to our consumers via our very active Consumer Advisory Committee, our complaints and compliments process, our community liaison staff. Karina's here today. And we've also rolled out Care Opinion to add to the ways we engage with our community. If you've got 5 minutes, Google Care Opinion. It allows you to see what others are saying about our health service and others, both good and bad, and allows you to see the responses and changes which may have come about due to your feedback. So, and that's just added to our processes. We continue to work with our health service partners in the Barwon South West region. Alice is here today representing the Barwon South West network. Thank you, Alice. With projects with Western Vic Primary Health Network and projects with some, if not all, of the other health services in our Barwon South West region. I chair the Virtual Care Steering Committee, and in 2024 will chair the Barwon South West Regional Integrated Cancer Service for 2024, and I'm co-chair of the Small Rural and Multipurpose Health Services in Victoria Forums for my sins. But just to highlight that we are very active in both regional and Victorian health. We're hopeful that working more with our partners in 24 and beyond will improve and increase our services to the community. For example, our infusion project, which has been amazing and improved the lives of many of our community for not having to travel. We hope to expand that to chemotherapy, but to do that, we'll need support from Barwon Health with training and the use of equipment. We already have a successful hub and spoke model for renal dialysis at Lorne, and we're hopeful that similar arrangements can work in both Apollo Bay and Lorne. And lastly, we're here today to celebrate our achievements and celebrate our wonderful workforce who continue to show resilience, dedication to public health. I'm also delighted that we'll be hearing from Cam Nugent shortly, as Cam has shown the dedication and resilience we all need to continue to battle chronic diseases like cancer and make sure our communities continue to live long, meaningful lives. Thank you.
It's an extraordinary amount of activity, isn't it, when you hear it all listed like that. So congratulations again to the staff. It's a real abundant, wonderful services that you're providing. And of course, a lot of it relies on your goodwill and the way that you take up your role, but some of it relies on funding. So Claire, if you could present the financial report, please. This is Claire Power, the Chair of the Finance, Audit and Risk Committee. Thank you.
Well, good afternoon, everyone. It's my pleasure to present the financial report for 2023. You've heard quite a lot this afternoon from Sandy and Joy in terms of the work that Great Ocean Road Health undertakes. And it is our strategic plan is based around our vision of providing great healthcare, which we need to achieve in a financially sustainable way. And I'm pleased to report that we've done that this year. It's the board's responsibility through the Finance, Audit and Risk Committee to monitor our finances. So as a committee, we look at each meeting, we look at the performance of the health service, we look at how we're tracking to our budget, and we also oversee our non-clinical risks, so we look at the key strategic risks. We are a not-for-profit health service, committed to serving our community, and you've heard so much about that today. It's just wonderful to hear. However, it doesn't mean we don't strive for a cash surplus and for a financially sustainable position. It's from that surplus that we have the opportunity for discretionary spending, and I'll take you through some of that in the presentation today. Given that objective, this year, we achieved a cash surplus of $382,000, which we are very pleased with. And that's thank you to the efforts of Joel, of the team, and many others across Great Ocean Road Health. I would also like to follow on from Sandy's thanks to the great contribution, to thank the great contribution made by our fundraising supporters and benefactors who work alongside us year after year and is so, so important to our operations. Sandy, as you've heard today, constantly reminds us that clinically and operationally, COVID unfortunately, it has not left us, and it also hasn't left us financially as well. We continue to spend a significant amount of money on COVID-related costs, from additional staffing, as you heard earlier, and as well as PPE and other related costs. In the last couple of years, much of our costs have been reimbursed. However, as we move forward, our key funding departments are treating these costs as business as usual. So we will need to work harder in 2024 to make ends meet. You can see on the slide that our revenue has tipped the scales at 23 million this year, and that's up, as you can see, from the prior year. Expenditure is higher, which is largely reflective of the increased costs from the ongoing impacts of COVID. If we flick to the next slide, I'll just take you through the funding. So the idea of this slide is to give you a picture of where the revenue comes from that supports the operations of Great Ocean Road Health. The Victorian Government, through the Department of Health, provide approximately 53% of our revenue, and the Commonwealth Government follows in second position with 23%. Our community service operations, and you heard again some of that through Sandy, the revenue there is a mixture of federal, state, and Shire-funded services, Meals on Wheels, home care package, and the Community Home Support Program, which is a growing source of revenue for us. Aged care fees and the GP practice revenue follow in significance. And then our fundraising, including our donations from the Lorne Op Shop, from Second Sales, Apollo Bay Freemasons, along with our benefactors. It's this last top-up of funds that provides us with the majority of our cash surpluses, allowing us to purchase much of the major medical equipment that allows us to provide those services close to home for our residents. To show you where the money goes, you can see that the great majority is expended on wages and salaries, with the rest taken up with supplies and consumables and general administration. Along with the majority of health services across the state, we've seen a significant increase in reliance on nurse agency costs, as Sandy mentioned earlier. Agency costs increased significantly from $1 million in 2022 to $1.8 million in 2023. So you can see the impact of that. In terms of some of the key highlights for 2023, an area of significant growth, as has been mentioned this afternoon, continues to be the number of home care recipients we provide services for. And you can see the increase on the slide. So jumping from 49 clients in June 2022 to 71 in June this year, and continuing to grow. Our spending on equipment and infrastructure also continues with the capital expenditure on the kitchen at Apollo Bay, and as a board we got a tour earlier this year, so it was great to see the work that's been undertaken there. Upgrades to our Wi-Fi and nurse on-call system are underway, and the Apollo Bay Medical Centre, we've just received funding for that, so you'll see activity commence there over the next year. We've also had the opportunity to purchase major medical equipment, including IV pumps, bladder scanner, ultrasound machines, and 2 Y-push wheelchairs. So you can see the positive impact that we're having in terms of the ability to purchase equipment. Through continued good management of our finances, we fully expect to provide sustainably great care well into the future, and that is the role of the board and the FAR committee to oversee that. Finally, I just want to thank 2 people, call out especially Joel and the wonderful work that he has done this year. He's been a phone call away when we've had many conversations this year. I did also want to thank Paul Shannon, just personally from me, and the wonderful work that he did up to June this year, and just the great counsel that he's provided to me and the rest of the board. And to the broader finance team, thank you so much for the wonderful work that you do, and we look forward to continued work in 2024. Thank you.
Thanks, Claire, and thanks to the finance team, and thanks to everybody who takes initiatives to find ways to make things more cost effective. So that we rely on your kind of ideas to help us do things as well. Just at this point in the meeting, I want to check and see, are there any questions of any of the reports? Does anybody want any further information? You'd like to get on and hear Cam, wouldn't you? All right, we've got a couple of other things to do. Thank you. So I will move on to the Years of Service Awards. We heard about how many people want to stay working here. But Sandy, I'll get you to join me, but I'll start off with, we have staff who've been very loyal here for 5 years. Now, if I call out your name, could you stand up, please, so that we can see you? Mark De La Warr. Karina Tachira. Megan Ford. Heather Hamling. Jane Jahn. Tegan Mortimer. Sue Mulder. Anne Newton. Amy Pickering. John Selkeld. Matthew Smith. Diane Solomon and Sandra Woods. Thank you to all those staff for their 5 years here on staff. Moving up, we have some people that have been here for 10 years. Georgina Harrison, Stability Masiko, Miranda Osman, and Evelyn Swidojewski. Thank you to all of those staff. I'll hand over to you now, Sandy.
Now we're really getting up. 15 years to Andrea Depler, who has spent a long time managing the finances and assisting Joel. So congratulations, Andrea, and Marley Coots from Apollo Bay. And now we award 20 years. So if Jason Feeler could come to the stage, please.
I suppose the only word I've really got to say is grateful. I'm very grateful to be at Lawn. I'm grateful for the experiences, the opportunity, but I'm most grateful for the team that I work with. I think, you know, it's your workplace and your colleagues at your workplace that make it such an enjoyable place to be at. That's why I'm still here after 20 years. We do say at Lawn, when people leave, they soon come back because they know how good it is at Lawn. And also kind of reflecting on the last 20 years, I think of when I first started at Lawn, you know, there was JB, John Beaumont, Nick Brayshaw were the quintessential, you know, country GPs on call 24/7, 7 days a week, nurses in their traditional roles of being handmaidens, not initiating much, waiting for the doctor to say things, and really how much things have changed in the last 20 years in rural health, but also how much Lawn's been a part of that cutting edge change in Victoria as well. It's something I'm very proud of, to be part of that team for that changes that we've made. And ultimately it's for the benefit of the patient and our community as well. So again, thank you very much, and I'm very grateful to be here.
And can you believe it? We've got someone who's been at Lawn Community Hospital and Great Ocean Road Health for 40 years. Now, unfortunately, Helen Moriarty, who some of you will know, is unable to be here today because she's being a community nurse in Aireys Inlet. And when I said to Helen, could you come and receive your award? And she said, no, I'll be busy, I'll be doing my nursing. And I said, well, could you give us, you know, some words? So here are Helen's words. Wow, 40 years. It has gone fast. I certainly did not expect to be here that long when I fronted up for my first shift a night duty, awesome, back in 1983. I got a short tour of the hospital before the evening nurse, Vicky Norton, went home and got very brief instructions on the clunky phone system, which we may not have improved. That was my orientation. I was then alone, the only staff member for the hospital and the emergency department till the morning staff arrived. This was at times very, very stressful. My nursing experience prior to this was in big hospitals in Melbourne and Darwin and quite different. The drive-in from Wye River, so Helen lives here, was eventful too over the years, especially before mobile phones. Over winter, I was often the only car on the road. One night I ran straight into a landslide on Mount Defiance and my little VW Beetle landed up on a large pile of rocks. I clambered down, you can probably imagine this for people who know Helen, and waited for someone to come along. After what seemed like an age, I decided to walk to the Cumberland River campground to hopefully find a phone and call for assistance. I did not even have a torch or a mobile phone with a light, and it started to rain. Unfortunately for me, when I got to the Cumberland, which is quite a walk really, it was deserted and closed up for the winter, so I had to walk back, hoping that someone would come along soon. The Lorne CRB team did come along after what seemed like a very long wait. They were my saviours and drove me to the hospital before they went back to clear the completely blocked Great Ocean Road. I think now such a crew would probably have to come from further away. And Helen says, I was not a fan of night duty, not many people are, but as a midwife it did mean that I got to be at a lot of births, which I really loved, and loved to care for the mums and the newborn babies, which she still does. My role changed many times over the years, and Helen did want me to say to you all, because she thought people would judge her for being at one organisation for 40 years, that she has had different roles. So with another midwife, Margot Sullivan, we started birthing classes, then domiciliary home visits when early discharge after childbirth commenced. The domiciliary visits are still done now, but infrequently as the demographic of Lorne and the area has changed. I'm most grateful for all the opportunities I've had during this time at Lorne and Great Ocean Road Health. We were and are given plenty of autonomy, but of course this comes with a lot of responsibility and stress and worry. Chris Cliff, a wonderful past Don, Director of Nursing, encouraged the RNs to do advanced life support courses, then introduced the RIPEN model, which Jason was just talking about. We were able to do a lot more assessments and care, especially when a doctor was not available. The op shop would provide funds for new and wonderful equipment. This was a great help. And lastly, I'm now working, literally now working, as a community nurse doing home visits. This is a role I really love. Obviously loves it more than attending the AGM to get her award. A little less stressful than urgent care for sure. We have a great team and get to drive around seeing patients in their domain for a change. I've had lots of opportunities for education courses and of course got to meet many wonderful people. The friendships I've made at Lorne Community Hospital and Great Ocean Road Health go on, and we now have meetups with retired staff. Perhaps that will be me one day. Cheers, Helen. Yeah. And now we do have a volunteer with us today who has volunteered for, guess what, 45 years of service at Otway Health and Great Ocean Road Health. So Christine Rook, could you please come and over?
Well done. Fantastic.
Christine, you are awesome. Oh, 45 years. Did you want to say anything?
Oh, well, I'll just say thanks to everybody, and thanks to past and present volunteers that are coming, and we all need to do it.
That's extraordinary, Christine. Thank you. Wonderful, wonderful. Go on, have your photo taken, that's right. I'd like to call on now our Deputy Chair, Nick Selkel, to present the Meg and Jim Lawless Scholarship. Thanks, Nick.
Thanks, Joy. I'm very pleased to present this year's Lawless Scholarship. We're already in our 6th year. The scholarship was commissioned by the board prior to the formation of Great Ocean Road Health, and it's in recognition of the distinguished service and commitment to the health outcomes of the Apollo Bay and District communities by general practitioners Dr. James Lawless and Dr. Margaret Lawless, or as we know them as Dr. Jim and Dr. Meg. The scholarship's to the value of up to $2,000 and is awarded each year at the AGM. It's awarded on merit to an employee of Great Ocean Road Health who demonstrates continued commitment to the health outcomes of the communities along the Great Ocean Road. So before presenting this year's award, I would first like to acknowledge last year's recipient, which is Jane Mapman, and pass on a few words of thanks on her behalf. In November 2023, I attended a course about how to provide advanced paediatric life support to children and babies. For this course, I read the latest evidence concerning trauma and common life-threatening illnesses. I completed modules that gave examples and then tested that knowledge, and finally with other clinicians we spent 3 days running simulations. For example, you're working at Lawn Hospital and you get a call that an 18-month-old en route to hospital after having poured a pot of boiling hot water on their face and torso. What do? To be clear, this isn't a part of my job that I enjoy. It makes me cringe like everyone else, and if possible, I'd certainly put up my hand to sit this one out. I hate seeing children suffering, and I verge on the overstimulated rather than the excited spectrum of ED nurses. However, these kids are beautiful children and like my kids, and more than what I fear is the need to do the best possible job. So with the Lawless Scholarship to support this training, I've been trained to approach these presentations with an efficient system and address issues that arise with increased skill. This course, in my opinion, should be mandatory for all clinicians working in remote communities. Paediatric presentations are very common in all rural locations, perhaps even more so in our tourist towns. This, coupled with minimal staff availability, means we all have a very important job to do to provide excellent care for these kids. So I'm thankful for this extra training, and I encourage others working with our kids to do the same. So thanks, Jane, for your words. Now to this year's award, I'm happy to present the 2023 Lawless Scholarship to Catherine Ross. Just a bit about Catherine. So Catherine's currently employed as an A&M at Great Ocean Road Health. She's very passionate about aged care and a strong advocate for people with dementia. Catherine intends to use the scholarship to support completion of a graduate diploma of dementia on her way to completion of nurse practitioner qualification. So Catherine, on behalf of the board, congratulations and thank you.
The World Health Organization estimates that there are more than 55 million people living with dementia worldwide, and that every year there are nearly 10 million new cases. Dementia is a term for several diseases that affect memory, thinking, the ability to perform daily activities. Statistics in Australia show that dementia is the second leading cause of death for all Australians, and it is actually the leading cause of death for women. In 2023, it is estimated that 1.5 million people in Australia are involved in caring for someone living with dementia. And more than 2/3 of people living in aged care facilities have moderate to severe cognitive impairment. It is with much gratitude that I am today accepting the Lawless Scholarship to assist in my studies in dementia. The course I am undertaking is the Graduate Diploma in Dementia, conducted through the University of Tasmania. Some of my learnings to date relate to personhood and person-centred care, best practice, clinical care, advanced care planning,
co-design and co-production with people living with dementia, dignity of risk, and the human rights of people living with dementia. I've also learnt in some depth the neurobiological pathologies underlying various types of dementia and pharmacological treatments available. Future learnings will include extension of these topics, policies and systems in dementia, and community and public health approaches to dementia. I feel that older people's lives will be improved with my increased expertise in the field of dementia and working to best practice standards. Having deeper understanding of the neurobiology underlying dementia conditions, as well as best practice approaches to care, will allow me to respond with strategies to assist, engage, and enable people living with dementia within our Lorne Aged Care facility and beyond. My goals include working to improve the quality of life for people living with dementia with the implementation of improved strategies, environmental changes, and improved responses to the difficulties people living with dementia face daily. The further aims include improvement of the holistic assessment of people living with dementia and subsequent improved management of their condition and comorbidities. Care planning, including advanced care planning as an ongoing process, and palliative care. Pharmacological management of dementia, dignity of risk enablement in collaboration with individuals and families, recognition of human rights of people living with dementia, with the recognition of dementia as a disability and the implications of this in dementia care. I am passionate about delivering high quality care to older people and feel that this course will assist in advancing my practice and improving the care I deliver. It wouldn't be a little speech by me if I didn't include a short poem. So I'd like to finish with a short poem written by a friend, Rosemary Blake, as her mother was living with dementia. In age, for my mother. For you, now, time is no longer a continuum, but endless repetition. Opening your presents here this afternoon, gifts we bring you tied with lilac ribbon. You rewrap carefully again each one to find with new surprise, oh my, how kind. Or you express delight to find me beside you as we sit together in uncertain sunlight by the ponds to watch the water birds, and earlier rain still beaded on the grass. Where did you come from? When I've been with you all the morning. And then lean against me for a while as if to gather strength for what's ahead as we walk back from the garden to the house. Thank you once again. Thank you.
Wonderful. Thank you, Catherine. We move on now to the second sales scholarship, and I invite Val Cameron to come to the stage. Val. Val's been at the Apollo Bay op shop forever, I think. Is that right, Val? Not quite. Do you want to say anything?
Yes.
Over to you.
Not quite forever. I had a longer time at the Apollo Bay Hospital, I've got to admit. Thank you. The inaugural scholarship that Otway Health through, I'm sorry, let me start again. On behalf of Second Sales Opportunities Shop in Apollo Bay. The coordinator, Raylene Hyatt, and all our volunteer members, I have the pleasure to present our inaugural scholarship to Liz Forrester.
Now, Liz can't be here today, but Shelley Pascoe is going to accept on Liz's behalf and do her speech. Val.
Thank you. Liz is going to do her course in wound care, which is so important to all our old clients and patients and residents in Apollo Bay, so I'm sure she will do a wonderful job of it.
Thank you so much. Liz is another nurse that's a community nurse that's out in the field today that said she's so busy and she really wants to be looking after the community today. So that's why Liz isn't here. But she said to pass on that she's extremely grateful and really values the opportunity to further study and support her community by starting a unit in the Masters of Wound Care at La Trobe. Liz has been a community nurse now for a number of years and is always looking to drive best practice and support her community and cares from the heart and loves the community that she's a part of and the broader team. So thank you so much. I greatly appreciate it.
You're welcome.
Thank you, Shelley, and congratulations to Liz, and thank you very much, Val. Can we just have another applause for Val? And Shelley, I'm sure that's your inspiring leadership. It's getting that happening. Good on you. Well done. We're moving on now to our Staff Living the Values Award. Some time ago when we developed the strategic plan, the staff and the community helped us develop a set of values. And our values are great, aren't they, Sandy? Do you want to talk about them a little bit first?
Yeah, I'm very proud of our GREAT values. They're easy to remember because they add up to GREAT. So genuine, respect, accountability, teamwork, and in the middle is empathy. So we have a wonderful staff that you've already heard. We have an awesome staff member nomination each week in Midweek Matters, and it's amazing how many staff are nominated. We give out our Staff Living the Values Awards every year at the AGM, and we have 2 staff nominated for each value. So what Joy and I are going to read today is the nomination from another staff member about their successful award nominees and winners. So firstly, for our genuine value, our first recipient is Charlotte Lurkey. Stand up? No, just stand. That would be amazing. So Charlotte has demonstrated ongoing motivation to extend herself in many areas this year for the better of her colleagues, consumers and the organisation. She's taken on many new initiatives, OVA training, manual handling training and mental health first aid training, which will improve the working lives of many and have a positive impact on consumers. She's been fantastic in organising and delivering the annual mandatory training days. Charlotte also took on a temporary support services role to cover leave, which was very much appreciated. Charlotte approaches new challenges in a positive, can-do manner and is a delight to work with. Well done, Charlotte. And the second winner is Monique Orca. Monique works in the IHSS admin coordinator role, which I can attest it's a very challenging role. And Monique, on a daily basis, consistently goes out of her way to support staff and consumers with the rostering and care preferences. She does this with a positive attitude and without complaint. Amazing. For instance, Monique could be changing a car booking to better suit a care worker or client, looking for a charger that has gone missing, helping someone reinstall apps on their phone, changing the roster to accommodate a client's changing plans, and other things. So there's no disruption of service. When it's busy, Monique will come in early to ensure everything is smooth for the rest of the team. With rostering, everyone knows, everyone hates rostering. It's a jigsaw puzzle and there are lots of moving pieces. If something has been missed, Monique will always take ownership and resolve any concerns. We're so lucky to have a dedicated, caring and genuine person such as Monique in our team. Well done, Monique and Charlotte.
And the R in GREAT is for respect, and our first award goes to Kana Haynes. Is Kana here? Not today. I'll read this out though. This is what the colleagues say. Kana continually meets Great Ocean Road Health's values. Kana is genuine and respectful to staff, colleagues and patients equally, going out of her way to be helpful and understanding. Kana works hard each day to meet the demands of a busy practice whilst demonstrating the patience of a saint. She shows compassion. I wonder why saints are required, but anyway. She shows compassion and empathy and will go out of her way to make sure everyone is okay, including the staff and patients. Kana is accountable for all her actions, knows when to ask for help and is open and transparent when required. She is a team player and an enjoyable member of the practice. And the second award goes to Catherine Coomans. KC, she's known as. A team player, always aware of others, always happy to assist and support staff, the public and students. She often goes above and beyond the call of duty, and that's got an exclamation mark against it. Nothing is too hard and she's always accountable for her actions. KC displays respect and empathy towards her patient and peers. She's professional and provides great care. Kath is an asset to our organisation.
Well done, Kana and Kath. Empathy, and these two are winners. If you knew them, you would highly endorse the nominations. So first we have Charlotte Page, also known as Charlie. Charlie is one of our wonderful social workers at Great Ocean Road Health. Nothing is ever too much for Charlie. She always has a smile and a kind, encouraging word for colleagues and clients alike. She jumps in whenever she can to help out at Great Ocean Road Health, and for her clients, often recognising what's needed without being asked. She approaches her work with true commitment and compassion, and I think this is evident in the ease in which clients and colleagues engage with her. I believe Charlie really embodies GORE's value of empathy and is an absolute asset to the organisation, community and individuals she works with. Well done, Charlie. And Di Solomon. Di has a big warm heart and is always genuinely checking in with other team members and team clients to see if they're okay. She actively listens and is happy for other people if something positive happens, and if a staff has any concern or are they upset, Di actively listens if they're okay. Di and I had a cry and a cuddle when my dog died, so I can evidence this. So thank you very much, Di, and well done, Charlie and Di.
The A stands for accountable, and this is about Jeff Schmidt. Jeff, are you here? I'll read this out. Jeff's super positive and a supportive team member, always thinking ahead as to how we can improve processes and tackle changes with enthusiasm. Jeff's driven many quality improvements across the community team, following through on actions with internal and external stakeholders to ensure improvements are completed and that the staff understand the changes. Some projects include changing to processing invoices, developing an intake manual and Medicare billing. Thank you, Jeff. All your work is greatly appreciated. And the second award goes to Lisa Hill. I'd like to nominate Lisa Hill for the Accountable Value Award, as she does a lot of background work in the clinical space, organising clinical audits and collating the results. She also compiles the NWAU Health Service Activity Reporting. She also has the laborious task of managing policy and procedures on prompt, and let me tell you, she can have it. That is a really big job. Lisa works conscientiously and has built up a wealth of knowledge over the years. She's always graciously willing to assist others for the betterment of the organisation, even when she is busy. Congratulations, Lisa, and congratulations, Jeff.
And last but by no means least is teamwork, and I've never worked in a health service where this is demonstrated so well every day. So the two nominees, the first one is Emily Greenfield. Emily has consistently embraced all additional duties that have been asked of her during staff absences, performing all of her tasks at a high standard with the health outcomes of the community and residents as her priority. Absolutely. She's achieved this while simultaneously notifying all community members of any changes and coordinating the necessary changes. Thank you, Emily. And for all that know Emily, know she's amazing. And the last one is for Daniel Forty, who, for those who know Dan, he's an amazing staff member. Dan is the activities coordinator in our Laura Pengilly Wing aged care facility at Apollo Bay, and he goes above and beyond for the residents. He volunteers out of his work hours to take residents to appointments, outings, and organises outings that are tailored to the residents' interests and wants. He works extremely well within the team. Staff always sigh in relief knowing he's working the shift with them. He shows initiative of all times. He always speaks highly of others and stays out of conflict. Probably the best thing is he cleans and organises Myrtle the Turtle's enclosure with zero prompting and upholds Gore high standards of care of Myrtle at all opportunities. He has excellent communication skills and will hand over any changes in residents. He's a strong patient advocate and will speak up to better the quality of care provided to the patient resident. Even when Dan has had a busy home life, he's always had time to listen and care about his fellow co-workers. He treats all equipment of Great Ocean Red Health with utmost respect and will always help others in need. Without him, aged care in Apollo Bay would not be the same. Well done, Dan.
And congratulations to all those staff. I can see there's a whole lot of food arriving out there. And we are at the second last part of our meeting. Absolutely delighted today to have a guest speaker, and that guest speaker being Cam Nugent. Cam, I saw you arrive and I think you've had a smile on your face the whole time, so can't wait to hear from you. So Cam is an actor, producer, come on up, and a writer and a director and an editor, and is our 2023 guest speaker, and we haven't had a guest speaker for a long time. We keep saying you've got 15 minutes and everyone has told me he won't do it in 15 minutes. So we'll see how you go. But recently Cam embarked on a journey, you're limping there, to raise funds towards breast cancer to honour his late wife, Sky. Anyone that follows Facebook or Love Your Sister will be familiar with Cam. So your own personal story of grief, your ambitions and promises that you made to Sky, I'm sure we'll find inspiring, but also help us remember the importance of finding a cure for cancer. So Cam, over to you. You've got 15 minutes. Let's see how you go.
Thank you so much for having me. I've been a bit under the weather. Been testing for COVID. I don't have it, but I usually go for a run to sort it out, but that's out of the question. My legs aren't working. Yeah, they're in an unusual state, but I'm so humbled to be in the presence of the group of people that I am, because on my way up I was trying to work out what I would talk about, because I usually don't prepare anything and I just go from off the cuff, and you've given me everything I need, to be brutally honest, because the lessons that I've learned over the last 10 years are the exact characteristics that I'm seeing everybody in this room already has developed, and it's you may take them for granted, but doing things for others, these helpless, selfless efforts that I'm hearing about, 45 years of volunteer work is extraordinary. But every one of you seems to have one of these stories. And so I feel like I'm late to the party, but I'll tell you my story, and how I see that fitting into the lawn community, which has given me so much over the last 10 years. And I still want to give back for the next, as long as I'll be here. And I'm not leaving. So I tell them at the football club, they keep asking if I'm coming back to coach next year. And I thought, you're probably going to have to vote me out, because there's no way I'm leaving what we've started at the club, and what I've realised is such a beautiful community. My story starts 8 years ago, and it doesn't start wonderfully. It actually starts at what was sort of a tragedy for me until I started to see the silver linings all around everything. But I met my wife in Melbourne. I lived in Melbourne for the longest time, and I was never leaving Melbourne. I was a city boy and I loved it. I was also one that was scared of commitment, and I was fine with it. Until I met Sky, who was a dental nurse below my office. I met her one day, and within half an hour, something in me changed. Like, it really did. And I wasn't one to believe that people can change. You are what you were. I was a leopard and my spots weren't moving. Until I met her, and she was so wonderfully open and courageous about what she'd been through, that within 10 minutes of sitting with her in a park and listening to her story about breast cancer, for which she was in remission, I was madly in love with her. And a week later, we used to argue about who asked who. I'm sticking to the story that she asked me to marry her, but I'm almost certain I probably asked her. We were married a month later without telling anybody. And it started probably the most harrowing, but the most beautiful journey in my life that brings me to this lectern right now. She was in remission. She'd been in remission for 4 years. And so those who understand cancer and breast cancer specifically, after 5 years, you're cleared. They're considered clear of the cancer. And so she was so looking forward to that. And so was I. We'd just started our lives together. We told our friends and family that we'd been married, and they were also in support of it, and quite surprised, considering my personality at the time, but they saw a distinct change in me. And so we started preparing our lives together. We rented a house immediately, and it wasn't long into that she had a pain in her back, and it wouldn't go away. And every night I'd massage her, and the oncologists and the physicians would say, no, she's fine, all her scans are fine, all of her tests are fine, and she'll be okay. But there was something about it that just didn't sit right. So we ended up getting a scan, and the news was horrible, to say the least. They gave us 2 to 3 months. And at the beginning of something that felt so wonderful, it felt like a light had been turned on in my life. Someone was trying to switch it off. But it wasn't me, it was Sky that grabbed me by the shoulders after we'd heard the news, and we'd had a couple of days to digest it, and for me to feel the most intense self-pity. She literally shook me and said, listen, I've got it, and I'm fine with it. I just need you to be next to me. And so we thought, okay, I didn't know what that meant at this stage, but she said, we're going to travel the world. And I thought, did she hear the oncologist just say that we had 2 to 3 months? And she mustn't have, or she just ignored it, which is one lesson that she taught me, that in the face of all the adversity, she just wanted to keep moving. And so we planned the first trip. Oncologist told us it was a disaster. Please go to a Commonwealth country. She's going to need to go to hospital. It's going to be a diplomatic problem for you when it happens. But I was listening to Sky because she'd changed everything in me. So I trusted her. So we went around the world. At the end of that first year, the tumour in the liver and all the bones had shrunk. We didn't know if it was the chemo or just us travelling. At the end of that year, we settled down a little bit, back into chemo, and we did it again. She planned again. Let's travel the world again. And these places got more and more exotic. We're in Nepal, we went to base camp, and we're all these places that physically she shouldn't have been able to do. But I was by her side. That's all she ever asked. And we just kept trudging through. after doing this for 3 odd years, she brought me to Lorne. And we'd both been to Lorne when we were young. We'd been like ships in the night almost, because we'd been to the Falls Festival the same year, and we must have just missed each other. But she took me up a hill, and we stood at this empty, vacant piece of land, and she said, yeah, I bought this. And I was looking at her hands. I didn't know if she was holding something. I said, what are you talking about? She said, I bought this bit of land here, and you're going to build me a house. And I thought, I'm a writer. I'll hold a hammer at the wrong end. And so, which I explained to her, and she said, I know. But she said, that's all I want from you. And I thought, it's a hell of a challenge, and I love challenges. And we both knew, it was unspoken, we both knew she'd never see it come to fruition, especially with me building. It was going to take me some time. And we'd already pushed the limit with the years that we'd had. But we'd gotten to the point where we would laugh about the illness. We didn't allow it to have the gravitas on us that the word cancer should have. And I think part of that bred a resilience in me and the want for a challenge that allowed me to take this very, very inclined piece of land on. And so over the next couple of years, we got a hotel room for the first 2 years, and I literally would go there every day. She'd sit on a bench, a little banana lounge, and she'd read. She's an avid reader, and I would build. I was digging holes, and so we got 2 years later. I had the structure built, and I'd got one of the local guys down, Brett Smart, who showed me how to do block work, because one of the provisions was that I had to build everything. So everything I could possibly build, I would do. And so 2 years later, we were walking along the beach here. She said she felt tired, and I said, we'll go back to Melbourne for some bloods. She needs some reds, we assumed. She looked a little jaundiced, which was also part of being low on reds. And when we got there, we also got I got some harrowing news. They didn't want to tell Sky, but I told her immediately, and she was fine with it. And I said, honey, it's too late to jump into another chemo. We don't have another one. And the tumour in your liver is quite big. And she said, I feel fine, I'm just tired. So we went back to Melbourne, to her folks' house, and we went to bed, and she never woke up from that sleep. So she passed away in her sleep quietly and very comfortably. But I knew I had a job to do. So for me, I understood what had happened. I allowed myself a week to grieve. But the resilience that she taught me, that I didn't have when she was initially diagnosed, I was ready to roll over. I thought, no. If there's anything she's given me, it's resilience. And I'm going to get back to that hill, and I'm going to keep building. So I got back there, and I thought, I don't need the comfort of a hotel anymore. I'm going to sleep in the car. So I slept for 2 years. I slept in the car. I'd work 8 hours a day, and I'd do my writing at night. Send it off. It was probably terrible. And then I did that for 2 years until I had a slab and a little bit of cover, and I put the tent on the slab. I did that for another 2 years. Meanwhile, I'm telling Mum I'm renting a house, so she didn't worry. Then after another 2 years, I had a roof over it, but I had a better tent. And then Lorne came to help me, because what I hadn't realised is I was very insular, and I was keeping everything to myself. And everybody knows a problem shared is a problem halved. Well, the problem I had, I wasn't as social as I used to be. And so I saw someone down the street, and they said, well, you want to coach it was the 15s at the time, but it ended up being the 18s. Do you want to coach the boys in football? And I thought to myself, that's a challenge. That's a different type of challenge. But I didn't have kids, and I loved working with kids, and I also have nephews and nieces I loved being around, and I thought that might be something that can bring back and revitalise me as a social person. But also, I was falling in love with Lorne. And I thought, if I'm here long term, and I want to be here long term, I need to meet the people of all the faces I see in the morning that I say, hey bud, hey mate, and I had no idea of their names. I thought, what a way. And so I started coaching the under-18s. And that just reinvigorated me to the point where I realised that this was the place I was supposed to be. Sky knew it. I didn't know it yet, and I know it now definitively. But I started coaching the 18s, and with that came this whole... I was regenerated to a degree, so I started building more excitedly. I was YouTubing everything, by the way. And so those 2 years went quite quickly, and I was throwing things about, and I had the roof ceiling up, and I plumbed, and I put in the electrics, and then the plumbers and the electricians would come and change everything. And so I finally got to a point just this year where I thought, this is ready now. This is ready to live in, and my house is done. What am I going to do? What can I do? And Sky loved a challenge, and I always loved running. And I've just thought, if there's one thing I've learned, and it's something that everybody here represents so wonderfully, it's the fact that I've honestly come to the conclusion that you can't feel whole until you're doing something for others. You really can't. That I suppose it's empathy, and it's just your social role. It fills the gaps that you sometimes don't even know are there. And it's allowed me to be whole to a degree. And I can thank Sky for that. I don't think I'm good at it, but I'm giving it a go. But I thought, I'd like to do something. So I thought maybe I could raise some money. And I didn't want to do it and say, oh, I'm doing this thing. But my friend Sam at Love Your Sister said, no, we're going to raise some money. We're going to raise $10,000. And I said, 10,000? That's a lot of money. I was thinking of 1,000 from friends. He said, no, I'll put it on Love Your Sister and we'll get it going. And we've got a lot of villages. And So with the next thing, and then all of a sudden, then I had to do a thing on the radio. And I thought, no, I don't want to do, I just wanted it to be our community. He said, no, shut up. Sam is an incredible money raiser. And so from there, it went to 30, and then 40, then 50, then 60, and we ended up raising nearly $250,000 for precision medicine, which is a general medicine for cancer patients in Australia that can't afford it. And so, I know the food's coming, it looks really good. And so, oh, the birds are getting him, watch the birds. And so, the plan was to run, and I love running, but the idea was to emulate a battle with cancer, which you don't get to train for. So I thought, I'm not going to train, I'm just going to run from Melbourne to Lorne. I'd driven it, and that felt really quick to a podcast. And then the night before I was going to do this run, I had this sinking feeling, because I'd asked so much of my young kids at the under 18s to do a lot for me, and I've always been one that loved a challenge, and I would never shy away from it. But I'd done a lot of talking, but I hadn't done a lot of doing yet. And tomorrow I was about to do, and I thought to myself, for want of a better term, shit, this is 155 kilometres. I'm 48, Cam, you're not 20 anymore. At 20, I might have had a shot at it. And so I had all these negative thoughts. And so the morning of the run, despite the fact I put on a brave face, I was thinking to myself, you're about to find out what kind of person you are, because Sky's watching. She knows she can do it, because that's what I kept telling myself. But I had these doubts. So I started this damn run. Some of you may have seen, it ended up an amble, because at 10 kilometres in at Spotswood, I tripped over a gutter and I've torn my AC. It's not a full tear, but it's a partial tear. And I said to the doctor running with me, I've done something bad here. He goes, what's up? I said, I've hurt my knee. He said, just run, you run it out. By the time I got to Werribee, I'm 30 k's in and it wasn't running out. The other one started hurting, and he said, you're limping. He stuck some paper in my shoe, and then we did some other stuff. I had some ice on. And so what was originally going to be a test of exhaustion and fatigue just turned into just a horrible test of pain. But I knew it would be temporary. And the pain that I saw my wife go through, and the pain sometimes you see patients and the discomfort and the nausea they go through, is insurmountably larger than what I would ever go through in those 24 hours. So I just thought, you've got to put your head down, you've got to understand what people are going through, you've got to put your feet where your mouth is, and you've got to finish this damn thing, because you've got so many people at the end wanting to have supported you, and I'm sure people in this room did, and the community was so wonderful. That's one thing I hate doing, is letting people down. And so I just put my head down, and every step really, really did hurt. And I just thought, if I can get to daylight, I'm a chance. And I got through the night. A farmer, it's incredible how people responded, but a farmer came out at 2 a.m. and ran with me from Lara to Little River, or the other way around. About 2.5 hours, this older bloke, about 75-year-old man, he'd lost his wife to breast cancer. and he ambled with me for hours, and he got me through to the morning. And then when I got there, the under-18s started coming on board. And all those times that I thought I'd asked things of them now, that was again helping me, and I thought, I've got to get to the end here. I've promised everyone so much. And so I busted and broke myself. And coming into Lorne was the most, I can't even say it without getting emotional, it was the most beautifully accepted I'd ever felt in anything I'd ever done. I've done a lot of silly things. I've done things and had successes and failures. But to see the community that Sky had chosen for me so perfectly. I was a weird shaped jigsaw piece, but she found a spot and I clicked in. And people at the roundabout and people coming out from the food works. And then everyone at that oval, it was that moment that I realised everything in my life had led to this point to make me feel like I was at home. And so I wanted to thank everybody here who made what I did, which isn't really that, honestly, it wasn't that hard in the end when I look back at it. The hard part was coming to the realisation that I'd been meandering through life so much and for so long. And now the hard part was just understanding that I didn't have to search anymore because I found the place I want to be. And I want to now try and instill some of those values that Sky taught me of resilience and selflessness and what I see here that's being exhibited every day, that you guys do as the heartbeat of Lorne, into some of the younger kids, because we're going to move on, but we have to be really cognizant of the fact that that younger generation is going to have to carry on what you guys have started, what I did a little bit of. And so my job's certainly not over. You know that your job's not over because I see the commitment that you guys have had for up to half a century. And so I thank you for having me here, and I hope that people like you can rub off on other people like it did to me. And Lorne is going to be stronger for it, and will always be an incredibly special place. And I'm not leaving anytime soon. So next year I'll talk your ear off again if you want about something else. But thank you for having me.
I think. I was just going to say, we're going to give Cam healthcare for life. He might need us. Thank you so much.
Thank you.
Help him off the stage.
That picture hurts as much as it looks. Sam said to me, when you get to the end, really play it up. Play it up. My legs were, I couldn't straighten, I had to straighten my legs. I was running like Forrest Gump at that stage, using the calipers. But all those kids there, I met them only years ago, and just what a wonderful group of kids, honestly. You don't understand how beautiful the younger generation are. I put some time into them and they're giving it back. They're bringing me food every other day, just the kids. They're just super loving it. So thank you for everyone that's had these children.
Please thank Cam. And Cam, thanks for bringing Sky to our meeting. Great to have her legacy here with us. So we've come to the close of our meeting. Before we finish up, I do want to say, Odette, thank you for all your help in preparing today and for helping the board throughout the year. Terrific job. This has just been fabulous to be able to showcase all the things that our staff do at Great Ocean Road Health. We've had a remarkable few years, and Cam, you just helped us finish it up beautifully, so thank you very much. Just one final thing I want to do before we close and you go out to the food and stop the birds eating it. Em, could you come up here, please? This is Emily Lenz, everybody, who was our comms person and has arranged AGMs for us for a long time, has since left us but is our consultant. And Sandy, I think you want to say a few words to him?
I do want to say a few words. So, firstly, Congratulations on your 10 years of service. Yeah. Just made it. And look, Em, this is I know we haven't given you your staff gift because we're waiting for the perfect opportunity, and here it is. So this is from all of us. Thank you for everything you've done for us and continue to do for us, and appreciate it very much.
Well, lucky, actually in my emails it has there as my position title. You can't get rid of me position, but I'm still here. But lucky, I always feel that photos say 1,000 words. So because I don't have any words, I put together a little video for you at the end, which sums up for me Great Ocean Road Health. And every year I really enjoy putting that video together, and it makes me cry because everyone here at Great Ocean Road Health are just absolutely amazing. And yeah, it's such a special workplace. So thank you.
So we're going to move to the video just to say thank you to everybody for all your work, all of your contributions. My tongue is getting dry. But just to say thank you. It's a wonderful organisation. We've got some great characters here. We do great work. I'm very grateful to the board for all their guidance and support. And to all of you as staff, as I've said many times, we're so proud of you. Thank you very much, and thanks everybody for attending today.
I need you, but I want you, and I miss you like the sea when I've been spending too much time away. And it ain't much, a car full of boys, and all of our stuff in the booth is messy most days. And if you come, we'll make this work. I know we can be stronger, we can be stronger now. And if you come, we'll make this work. I know we can be stronger, we can be stronger now. And there'll be times when I need you to tell me that I'm just tired and I need to sleep tonight, but spending too much time awake. And it ain't much, a car full of boys and all of our stuff, and we wear the same clothes most days. If you come, we'll make this work. I know we can be stronger, we can be stronger now. Say that, honey, I crave you, and you make me feel like everything is alright, and I know I'll make you feel the same. And really we don't need much, really we just need us to learn about trust, and the baggage will never be heavy any of those ways. And if you come, we'll make this work. I know we can be stronger, we can be stronger now. And if you come, we'll make this work. I know we can be stronger, we can be stronger now. And if you come, we'll make this work. I know we can be stronger, we can be stronger now. And if you come, we'll make this work. I know we can be stronger, we can be stronger now. That we can be stronger, we can be stronger now. That we can be stronger, we can be stronger now.